All right, it is Thursday. I'm recording a day earlier today, January 15, 2026. Welcome to the Borderlands podcast, a Canadian immigration podcast. Sorry, it didn't go live. I'll just hit record again. All right, and we are live. Okay, it is January 15, 2026. Welcome to the Borderlands podcast. My name is Stephen Meurrens, joined as always by Deanna Okun-Nachoff, and we have a very special guest today, Dr. Brian Day, who is a past president of the Canadian Medical Association in Canada, an orthopedic surgeon, and someone who is very familiar with healthcare law or healthcare policy in Canada, having launched numerous challenges to the way the Canadian healthcare system is set up. Brian, thanks for making the time to come on today. I know you must be super busy.
You're welcome.
And the topic that we want to discuss is one that's becoming increasingly topical in Canada's immigration system, which is the way the government is trying to use immigration as a way to solve what I think is getting increasingly recognized as a healthcare shortage crisis. And there are all sorts of angles to approach this on, and people have raised all sorts of different questions that they want me to ask you. And I think the main one that I want to start with, which is one that I've been asking quite a bit recently as I interact with more clients who are physicians, is that it's been interesting to me to see how many hospitals or even regions seem to rely on doctors who are permanent residents, or even in some cases work permit holders. And I'll have clients who will basically, have to be careful to not identify anyone, but in this certain region, I'm the only, radiologist, for example, or without me, this hospital wouldn't have an oncologist. And I was just wondering if you could sort of walk us through how it came to be that it seems to be a shortage of Canadian citizen doctors.
Well, it's actually government policy that is responsible fundamentally. And in the early 1990s, governments across the country had this weird theory that the rising costs of healthcare were caused by doctors and nurses treating patients, which in a way they were right, but that's because the needs, the population was increasing, medicine was becoming more complex, and it was becoming more expensive, and more time was needed, and more doctors and nurses were needed. But the government had this strange theory that the solution would be to cut back on the number of doctors and close nursing schools also across the country, and medical schools were cut back by between 10 and 30% nationally. In the Ontario government, for example, offered to pay the medical school in the University of Toronto $10 million a year if it would cut back on its medical school intake. And guess what? We now developed a shortage of doctors. When I came to Canada as an immigrant doctor, we were third in the world in doctors per population. There's a group called Index Mundi now, who've rated us 76th in the world in doctors per population. And we're one of the wealthiest countries on the planet, and yet we're down at the bottom. And yes, immigrant doctors are one solution, but those immigrant doctors are also being restricted. We have up to 5,000 is the latest numbers, young Canadians who are going to foreign medical schools because of the lack of capacity in Canada. And, we've surveys have shown that half of them never come back. And when you're in your early 20s and you go to Australia or Ireland there's a chance you might meet someone there and stay there. And that's what happens to roughly 50%. We're losing Canadian talent. So it's a complex set of processes that are leading to, that have led to this situation.
And David Eby,
so there's been no attempt to kind of
Deanna, I think
right size the.
Yeah, I think there might be something with your internet, but so David Eby provincially has, I think they're building a new medical center, a new med school at SFU. Is that going to be just a drop in the bucket, or?
Yes, it's going to be a drop in the bucket, and it's going to take a long time. I mean, that concept of creating a new medical school was something in Fraser Health was something that I worked on with a former premier under the BC Liberals decades ago, and now there are, but it's a drop, as you can imagine, being ranked where we are in the world is one thing. But the other thing, it's not just the shortage of doctors, it's the shortage of facilities that where the doctors work, and we ration. We were involved in a long-standing legal battle, and the BC Appeal Court came out with a ruling that that healthcare in British Columbia is rationed or deliberately rationed by the government in order to maintain fiscal sustainability. So it's more complex than one thinks. I think the medical school is being built for political pressure, based on political pressures. But as I said, we've got 5,000 young Canadians already going to medical schools in places like Melbourne and Sydney, Australia, and Dublin, Ireland, and that's because of this lack of capacity. So it's going to be a good thing to have another medical school, but it's a small step.
Do you encounter a lot of people from abroad who want to come here and be doctors? So some things that the Canadian immigration system has done to try to encourage more physicians is actually until about a week or until about a year or two ago, doctors who were working self-employed in Canada wouldn't qualify for express entry. So they brought in measures to change that. The other thing that they just announced about a week ago is doctors who have worked here for a year can now get a dedicated immigration stream. So I guess there's 2 points. Number one, do you encounter a lot of people who want to come here and are having struggles to immigrate as doctors? And two, even if they get here, it sounds like there's budgetary constraints as to whether they'd even be able to practice.
Yeah, I suspect they're not encouraging doctors to come here. This is a complex thing. I mean, I know when I came here, and this is obviously many decades ago, that I wanted to come just on a 1-year visa, and actually there was Canadian government representatives in London, England, who persuaded me to come as an immigrant, saying, well, you might as well come as an immigrant, and there's no disadvantage. And so they were encouraging immigrants, doctors back then, because they wanted them. Now, how, to me, the issue here is there are a number of issues. Obviously, we've got to be confident that those immigrant doctors are of the same quality or can achieve the same quality. And generally, that's not a big issue. They have to take some exams to show that. We have the history of where they were trained and what kind of training, and they have to go through a process. That's not, but I think that that the fundamental issue is that Canadian governments still don't really want doctors, because under our health system, rationing patient care is the way to fiscal sustainability, and the courts have ruled on that. That governments, we are the only country on earth with a purely government-only funded health system in terms of hospitals and medical procedures. No other country does this, and the statistics show that Canada is one of the highest spenders of developed countries with universal healthcare. In the OECD, we're one of the highest spenders and one of the worst performers. So our system is not working to the benefit of patients, and it's providing doctors, especially family physicians, because as you know, emergency rooms now are even being overloaded with patients, and we part of the reason for that is we don't have family doctors. We don't have. It's an extreme rarity nowadays for a family doctor to do a house call. 6.5 million Canadians don't have a family doctor, which is one of the ways to limit the overloading of emergency rooms. So it's a crisis, and governments have neglected this system for so long that it's not an easy fix.
When you say a house call, do you mean where the doctor goes to your house?
Yeah,
So I don't think I've ever even wow. I don't know.
Exactly, but it used to be very common. It used to be. In fact, when we were young doctors, when we were specialists in training, we would actually moonlight and do house calls for family physicians. There were lots of young doctors who were, when family physicians went on vacation, we would go and do the house calls for them. Yes, so doctors used to come to your home. And actually, if you look at the fee schedule in British Columbia for doctor services, there is still a fee for a doctor doing a house call. The problem is the incentive is not there, because the fee for a doctor doing a house call is about 25% of what it would cost to get an electrician or a plumber to come to your house.
Oh, wow.
I know my GP does house calls, but I think she's a unicorn.
Yeah.
It's one of those things where I'm like, oh, I've seen this in movies, but
No, it's there. And of course, if you had enough family, it's actually a very good way. It's a very economic way for the government in a government funded or a non-government funded system, because it cuts back on patients going to hospitals. It cuts back on them elderly patients. We have an aging population now, the highest percentage of over 75-year-olds in history, and a lot of the elderly people are not mobile. It's a big effort for them to get into a vehicle and travel to a doctor or to an emergency room. But of course, when you have a massive shortage and you're underpaying the family physicians by, as I say, 25% of a plumber, I kind of joke, one of the things we should be doing in medical school now is training doctors to do elementary plumbing and fix locks, and so they could start doing house calls again.
Because the government, I guess, dictates the rate they can charge if a doctor chose to do a house call.
100%. Yeah,
versus, I guess, like the 15-minute slots if you go to them.
A lot of what you're saying is kind of akin to what Steve and I talk about a lot on the podcast about public policy having very little to do with basic common sense. And I'm just curious whether or not, this talk about rationing healthcare, Is this like a live conversation in healthcare policy? Is this something that is being actively debated? Because this is certainly not something that I've ever heard about in any of the reading that I've done or in the media. It doesn't seem front and center of the medical debate. We hear a lot about credential recognition. We hear a lot about nursing shortages, but very little about this kind of public policy against actually graduating the number of medical professionals that we require, or about. So I'm curious where this conversation is.
Or you hear about a shortage of beds, like the issue is we don't have enough
shortage
mattresses.
of beds. But again, even
with
that, the shortage of
beds,
I've been told is just a shortage of nurses to service those beds. I've heard that much, but not about where the shortage of nurses actually comes from.
Yeah, well, these, I think that the public need to understand that the shortage of doctors, the closure of nursing schools was enacted by governments. Every big hospital used to have nursing schools. At St. Paul's in Vancouver, at VGH, at the hospitals in Surrey, there were nursing schools attached to them. Same with the medical schools. The medical schools would just grow, and immigrant doctors were welcomed, and we had to pass the Canadian exams to get to show that we were competent. But I mean, it's pretty, especially from countries where like Australia and England and Sweden and Switzerland, Germany, these medical systems and their training, they were on a par with Canada's. But now we've seen in my time the opposite of immigration. So I used to be the chairman of the academic training program for orthopedic surgeons at the University of British Columbia. And during a 5-year period, we had trained 16 orthopedic surgeons graduated from our program at UBC. Only 5 could get jobs in Canada. The other 11 left for the United States, the opposite of immigration. And the reason was they were not able to get operating time in the public hospitals. The hospitals were closing at 3:00 in the afternoon, again, to maintain the budget. And this is what happens. So Canada, this is an aside, but Canada is unique in the OECD in exclusively funding hospitals with an annual global fixed budget. So that say a hospital, these aren't the precise figures, but say a hospital like Vancouver General Hospital might be given $3 billion a year to operate. Therefore, every patient that comes to that hospital is a consumer of the annual budget, as opposed to other OECD countries where in the public system, if a patient goes to the hospital, they carry public funding with them. So the hospitals have an incentive in other countries to treat patients, because the more patients they treat, the more revenue they get. In Canada, our hospitals, for the more patients they treat, the less revenue. They're using up the annual budget. So a chief financial officer of a hospital in Canada, as opposed to in Germany or Holland or Switzerland or Australia or New Zealand, chief financial officer, the last thing they want are patients. And we're talking about the public funding. So in a country like Germany, if a patient goes for a hip replacement, they might the hospital will generate, say, I'm making up the numbers, but $15,000 for that procedure and the aftercare. In Canada, the patient uses up the $15,000 of the hospitals. So there is a disincentive to treat patients. And this is part of the imposed rationing that is part of government policy. And the reason is we have a unique system of government-only funding for hospitals. So so the wealthy in Canada get quotes free healthcare. They might wait 18 months, but the wealthy in countries like Switzerland would be paying premiums. The reality is we do this in theory because we want equity, but when you look at surveys of healthcare in Canada, we rank of the rich countries, we rank last in equity. In Canada, lowest income groups have the worst health access and the worst health outcomes. So it's not achieving its goal.
Yeah, and the other thing that I'm
And
at
that's
least
because so
noticing
many
more and more people going back to their Chinese people deciding they're going to go back to China for whatever procedure. You can replicate that amongst any other country. When I started practicing immigration, the healthcare system here was viewed as a plus for Americans, and now a big concern from a lot who move here is how can I retain my U.S. health insurance? I don't even know how much more strained is there data on how much more the system would be strained if immigrants weren't returning to their respective countries of citizenship for treatment?
Well, we know.
Yeah, totally. I'm seeing this for people from Brazil, across Asia, and I'm also seeing a lot of Canadians into their vacations getting medical care in Korea, in Japan, and in all of these medical destination countries now, where they're getting faster, cheaper medical care and of a higher standard even than what they're able to access in Canada, and without the wait time as well, which again talks about that disparity in terms of who is able to access prompt care.
So an estimated at least 300,000 Canadians go abroad for healthcare every year. And it's probably quite an underestimate because we don't know when someone, we don't know every individual. Those figures are based on specialist surveys of specialists. They're based on some Stats Canada information. But when someone makes an independent decision to go, we don't necessarily know that. And of course, two things. One, that is they are leaving the country. This is in economic terms a loss to the economy, because what other countries do is the exact opposite. So countries like Malaysia and Singapore and even countries like Britain and even communist countries like Cuba, they actually generate revenue by the reverse. It's called medical tourism. So the biggest group of medical tourists in the world are Americans. And it's not because they can't get access, it's because it's expensive in the United States. So a lot of them travel abroad for healthcare, for surgery, for hip replacements and all kinds of surgeries. An estimated 2 million Americans leave the country every year and go to these countries so medical tourism has become a massive and still growing, probably multi-billion-dollar industry. That if Canada were able to, we're one of the biggest probably the top 2 trading partners of the United States. We get none of that revenue because of our health system. So there's a potential, if we opened up our system and encouraged immigration, and encouraged more doctors, encouraged more hospitals and medical schools, that this could become one of Canada's biggest, knowing that the biggest group of users is the United States, this could become a massive industry in Canada, generating revenue for the country. Instead, we have a shortage of doctors created by government. We have in strict terms, we don't have a shortage of nurses. If you look at world data on nurses per population, But what we do have is an internal loss, and an external loss. They aren't working because of this terrible state of healthcare. Nurses don't want to work here, but also as part of the rationing, they can't get full-time work. So in Ontario alone, the stats show 2,000 Ontario nurses commute every day down to the United States to work because they cannot get full-time work here.
That's crazy. Yeah.
Well, the other thing that was weird, I remember a few years ago in British Columbia and in Vancouver, a city of 2-3 million, whatever we're at, had to send cancer patients to Bellingham, a city of 90,000.
Yeah. Well, no, we did it last year.
So it's still going on.
Yeah, no, it's happened over the years. There's a lot of patients do travel down to Bellingham still, and the government pays for some patients to go and get cancer treatments down there.
Yeah.
So what is the math on that? Is it just cheaper to do patient by patient rather than to just increase the cancer budget here and hire doctors?
No, it isn't. But this is politically driven, and so in the long term, it would be much cheaper to treat people quickly. We know, like for instance, if you diagnose and treat a patient quickly, it's cheaper in the long term. So just one example, a serious cancer, say stage 1 breast cancer, with breast cancer in a young woman is treated. The total treatment, surgery and medications and everything is 1/10 of what it costs to treat a stage 4 breast cancer. And so might be 25,000 to 250 or more thousand. 35, maybe it's a bit more than that. But the reality is that's over. Governments tend to operate only in 3-year financial cycles. So they don't really care what's going to happen 10 years from now financially. So we're letting this massive unfunded liability of patients on wait lists. And as I alluded to earlier, the sad reality is if you let patients die, it's cheaper. And this sounds terrible, but that's what governments are doing. That's what the BC government is doing. It's letting patients die on public wait lists because it's cheap.
And one of the more, kind of ironic things from, say, the progressives, if you believe that universal health care restricted only to universal health care is a progressive value. I don't really understand why that is, but if you do believe
it's not by that standard, yeah.
No, but so one of the things in
cheapest,
Canadian is because there's no ability to contract out of the public system. If someone, say, even if they've been working here for years, has a sick kid or is sick themselves, they can be what's called medically inadmissible for being an excessive demand on the Canadian healthcare system. In all the different forms, and so one of the big challenges is these families will often plead saying, well, we'll pay our own way. We don't want to be a burden on the system. We can afford to pay, but the system doesn't let people pay their own way, the healthcare system. So instead, they essentially have to be declared inadmissible to Canada. Has there been any, is that an issue that's a live discussion, or is that super niche and not sort of part of the discussion right now? Is that intersection of immigrants being either denied entry to Canada or deported because they would be, quote, an excessive demand on the system?
Well, yes. And I think there are, it is a fact that the more people you have, the more healthcare you need. And that's, so yes, immigration is adding to the stress of healthcare for sure. And that's why when you have increased immigration, you need to increase healthcare. But this comes back to another fundamental issue, is that we are the only country on the whole planet that outlaws private health insurance for medically required procedures. And bizarrely, you know, we talk about having a universal and comprehensive system. It's nothing like comprehensive. I mean, we are the only publicly funded, quotes, because it isn't real, universal system that doesn't cover prescription drugs. It doesn't cover dentistry. It doesn't cover even an ambulance in Canada. It doesn't even cover, you know, you get
Psychiatry.
it's counseling. It covers you if you're very severe, but that's if you can get a psychiatrist. You know, it's very, they have some of the biggest wait lists. But the reality is that that these facts all increase the prices. Now, 70% of Canadians have private health insurance for prescription drugs and dentistry and physio and so on. So we do have private health insurance. It's just that we've arbitrarily decided that an ambulance, for instance, if you break a leg or you have a heart attack and you need an ambulance to get to the hospital, and you don't have insurance, you got a bill for that. Even if you're a child or a senior, you got a bill for that. This is the only universal system in the world in the developed world where ambulances aren't covered. And, you know, in countries like New Zealand and England, if you're a visitor with no health coverage and no insurance and you need an ambulance, it's free, because the government has designated that as such an essential service. They will cover it for everybody. Here, we don't cover it for our own citizens. And Canadians just accept this as, oh, it's what we're giving you, just take it or leave it, because you've got no choice. We are, to be the only country on earth where private health insurance is illegal. Even when you're sick and on a wait list, you are mandated by the government. It's illegal for you to pay for private care independently. It's illegal. Now, I am all in favor of looking after low-income groups. But what happens in countries like Holland and Switzerland is that the premiums for their private insurance of low-income groups is funded by the state. So they get it too. So when I lived in Switzerland for a while and observed that low-income Swiss, workers would be in the same private hospitals and private rooms as wealthy billionaires, because they had the same insurance, but they didn't have to pay the premiums. Premiums were paid by the government.
Right.
But the principle was, it's cheaper. It was cheaper to treat them quickly, because for the reasons we mentioned before.
And that those who can afford to pay the premiums then are taking there's less tax. It's less taxing on the public system because those are funding and all of that sort of thing. And something that you said about the medical tourism, I think that what you said is that's probably the numbers are very underrepresentative of who's actually going. And I think particularly for things like diagnostics, I'm sure the numbers are entirely underrepresentative because nobody's tracking who's going for diagnostics. And I think that the cost, like the amount of profit that people could be generating from getting that diagnostics done on a privatized basis, with people paying insurance premiums or whatever that might be, I imagine is enormous.
They had a client who went to Shanghai and it was like a vending machine. They did an MRI and then they were able to go up, hit some buttons, their images came out.
Totally. I've done this too. You go onto the website, you can select which service you want, which language you want it in, you pick a package. Yes, I would like these tests. And, you just walk in and you get the services and all the tests. And, it would remedy that issue of late diagnoses. And I heard you speaking on a different interview about the push, like the the other impacts of late treatment and late diagnoses, which are like addiction, mental health issues, like it creates all these additional healthcare costs, because of the worsening of the condition and because of the medication required to treat pain and, the trauma that might happen because of prolonged chronic pain and all of this kind of thing, which I thought was just super fascinating as well.
Yeah, I mean, I think that that there is no disadvantage to letting wealthy people pay more. That's to me is true socialism, where I mean, Conrad Black doesn't need free public health insurance. Let people like that pay their own premiums and add revenue to the health system, and let us instead direct our tax funds to those who can't afford it. And that's why we've ended up as, if you look at the top 10 countries in terms of the developed world with universal healthcare, the top 10 countries with universal healthcare, we're at the bottom in terms of performance and at the top in terms of cost. So there's something wrong with that statement.
Yeah. So let's kind of map it through. So when the government announced that they were going to try to create a new program for doctors, the Canadian Medical Association put out a press release saying, good, there's apparently 13,000 internationally trained doctors in Canada who aren't working in their field. And you can add to that, say, people who are here on work permits. Last week, Tamara mentioned on the show that she'd been approached by a foreign worker doctor who was a surgeon who had a work permit refused due to a technicality. And all of a sudden there was a scramble to figure out what to do with surgeries. So you take the 13,000 plus however many work permit holders there are. But let's say they all get PR, they all get their credentials recognized. If the system itself can't afford to actually utilize their services, what are they going to, where does that lead? It seems like there's this big barrier that no matter how many doctors get added, the country under our current system can't actually afford for them to be doctors.
Well, you're right. The reality is, and the governments know this, that things like, oh, we're going to build a new medical school, these are politically driven decisions. They are not interested in expanding the health system in terms of treating patients because they can't afford to. And my position on this is true socialism requires that you direct the funds to those in need and let those who can afford. And this principle is already applied, as I said, to prescriptions, to ambulances, to dentistry, to physiotherapy. To me, to put it in simplistic terms, you go to see your family doctor, and you're given you're diagnosed with having an infection. That's considered medically necessary and covered. But the treatment, when they give you a prescription, is not considered medically necessary. This is bizarre politics, and this is the way. This is all definite, arbitrary government definitions that are meaningless and make no sense whatsoever. So we are actually, the public is being conned on this.
The other thing that also, and maybe I don't know if you have comment on it, but I remember last year, or probably 2024 now, it was kind of right when before the government did its immigration pivot, there was talk of a capital gains increase where numerous medical associations were expressing concern. And I can't remember if it was a Liberal member of Parliament or a Liberal cabinet minister who basically said, well, and so doctors were saying they may leave or retire, and the Liberal MP said, well, we can always just bring in new doctors cheaper to replace any Canadian doctor who's upset about making less. Are there what are there concerns within, like, I thought it was the weirdest messaging, and like, I only heard it once, but are there concerns within the profession that in order to, basically afford the current system, that like not necessarily medical standards, but that pay has to go down, what we pay for treatment has to go down, the amount of time you get to go with your doctor goes down, all under this rationing of like, what can we do with less instead of how can we make the experience better?
Yeah, I mean, to reiterate, the courts have ruled that healthcare is deliberately rationed in Canada, in BC and Canada, and that so there is no incentive on the part of governments to expand access to healthcare. There's a disincentive, and that is their budgets are hurt, and the reality is, there are things we can do now with, 50 years ago, people didn't get heart transplants, liver transplants. They didn't get, all of this complex surgery. One of the things in my field is I was one of the pioneers of less invasive surgery for sports injuries. And of course, when you make surgery less invasive, more people are eligible for it, because there are people, if you have a knee problem that's stopping you from playing a sport or skiing, and it's a 5-day hospital stay compared to in and out within a few hours and you're back skiing in 3 or 4 weeks, the numbers of eligible patients expand even without the population growth. So as we make surgeries less, people who had a gallbladder that was irritating them, but not to the point of serious but was causing pain every few days, they might not want to go in and have a hospital procedure. It's going to keep them in for a week and then take 3 months, 6 months to recover. But when it's in and out the same day and you're recovered in a few weeks, it increases the demand for that procedure. So as we become victims of our own successes, as we make procedures less invasive, less painful, more accessible, quicker in and out, but we don't necessarily make them, we don't necessarily make the system cheaper. So there might be more patients eligible for that procedure. And also, one of the other things that happened is, decades ago, someone would come in for a procedure in a hospital and they'd be in hospital for 5 or 6 days afterwards. And when they have the procedure, that's a fairly expensive thing, operating time and so on and so on. And, there's all that. You might be using a joint implant and that costs thousands of dollars. But if you now can have that patient, as they do now, with a knee replacement in and out the same day, that means another patient can come in, and another patient and another patient. Whereas in the old days, that patient would block the hospital bed for 5 or 6 days. And on the day after surgery, all they need is, some light lunch and a cup of coffee. It's not costing very much compared to you open up the bed, in comes another expensive hip or knee replacement. So there are many reasons why the health costs have risen, not just the population growth, but the population aging, the demographics, the baby boomers. And I'm one of the oldest baby boomers. We're hitting the health system hard now, but it's going to get much worse in the next 5-10 years. And the young people are not going to be able to, our Canadian youth are not going to be able to afford to look after the massive health needs that the aging baby boomer population are about to hit the system with.
Which means there needs to be another funding source. Like, it can't operate either that, or there just needs to be a much greater allocation of the public budget per annum. Like, it just
seniors, as one example. I mean, I'm a senior, quotes by the definition of seniors. I don't need free ferry rides. I'm
Yeah.
sorry. So my kids who are working are paying for seniors. 2/3 of the wealth of the country is in the hands of those over the age of 65, and youth are paying for those seniors to have free bus tickets and bus ferry rides and all the free things that seniors get because they're seniors. It's bizarre, and it's not necessary that we are actually mortgaging our youth. We are putting a massive debt on the next generation of Canadians by what we're doing.
Just
There's
looking
been
at
no paradigm shift. Yeah.
well, no, I think the paradigm shift has been that the youth vote, which was traditionally thought of as like always going to be NDP or Liberal, is now conservative. And it's the boomers in the last election who, there's been this pivot. And so I don't know. Well, so I guess that would be maybe my last question for you is sort of with this, this pivot of, I think, increasing focus, you hear generation squeeze, the conservatives rising with younger voters. And I think a general perspective that pendulum, at least on youth, is swinging to the right. Where do you see, assuming the courts won't be the ones to compel change, what do you see, like you mentioned the strain will get worse. Where do you see the overall system being in 5 to 10 years?
Well, it's imploding. Like, honestly, this can't carry on. And I think eventually the youth will rebel. I think you're right. Like, we are imposing a massive debt load on the next generation. Yeah. We're making them work. We're making them pay high taxes and for minimal benefits, and we are as the baby boomers retire, they're going to become a bigger drain on the economy, and young people are I know this, the young productive Canadians are going to leave the country and work elsewhere. That's the reality. We can't keep taxing them, and they can't. When I came to Canada, the average, most workers who were in a reasonably good job after 3 or 4 years could afford a house. There's no way you can afford a house in British Columbia now.
No.
So
well, and the other, like you hear,
the youth cannot afford to live here unless things change.
Yeah. And I kind of alluded to it at the start, like you hear about in rural BC, especially, some doctor retires and that's it. The city doesn't have a doctor anymore. The emergency room is now basically closed half the time. Is there any reason to think that trend will reverse? Would immigration play a role? It's not clear to me how immigration would play a role.
Politicians are afraid of this issue. It's been, it's quotes. People have quoted. I've used the phrase, our Medicare is a defining feature of our nationhood. Well, that's a bizarre statement to say that a system that allows tens of thousands of Canadians to die on wait lists, that doesn't cover medications, that doesn't cover ambulances, that doesn't cover an elderly person gets a hip replacement, knee replacement, or a sports injury, surgery, and you can't get physio without paying for. This is not a system to be envied by any country in the world. There's not a single country that has copied the Canadian health system.
Totally. And that it directly contributes to increasing addiction, increasing mental health issues, all this sort of thing. I think that it's, I think that, and this is something that we say repeatedly about the immigration system, there is an inherent arrogance about well, this will always be, a destination of choice globally. But I think that is proving in the medical field as well as in the just generally as a global competitor, that is proving itself to be an untenable premise right now. I think what you said about the public is being conned, I think is really salient because if you travel, Steve keeps making the joke that I'm like a Japan groupie right now, but you travel right now to Japan and you're like, we are not the cutting edge of anything. It doesn't feel like, and I think that Canada has really like missed the boat and is not like, it's not actually understanding the failures and not learning from other countries, not understanding that we have created this massive brain drain and that we are not looking like a destination of choice in any way right now.
Right. It's a country that it has so much potential, because
Totally.
when you look at what we have in natural resources and minerals and farming and fisheries and everything,
Totally.
and yet the only and those are the only reasons it's surviving, is it has so much inherent wealth that it doesn't require much expertise to be able to stay, to maintain the status quo. But in healthcare, it's draining us, and something has to change.
I think that's why we're all like struggling so much to be like, let's actually see that these conversations are not being had openly and honestly, because I think that it would take a reorganization, no doubt. But like, if we were to actually talk about the narrative and like some of these conversations and have them.
Well, as soon as you say it, you get accused of being a Trumpian pro, like as if there's only two systems. Anyways, Dr. Day, I want to be mindful of your time.
Yeah,
people
this
can
has been
find
super
you
fascinating.
on Twitter at Dr. with Dr. Brian Day, all one, no spaces. Where if they follow you, they can see, kind of this discussion continued in terms of challenges to the system. And thanks for coming on. I know you're super busy.
Yeah. Kudos for everything you're doing.
And hopefully things are going to get better.
Yeah.
Awesome.
Okay.
Perfect. And